Okay, so for those who are here with me, welcome to this webinar. I started before, but then the sound was not working, so our apologies for that. And if you are not able to be with us live right now, then hopefully you can watch this webinar later on using the link that you received. So this webinar, I'm going to talk about the skeleton actually, and how the skeleton influences the way we move. So the shape of the skeleton is different for everyone. So whether you do yoga poses or when you go out and do any kind of sport, you take your skeleton with you to do that. And surrounding the skeletons are all the tissues like the fascia, the muscle, the tendons, everything else that is surrounding as a coat your skeleton. But it's apart from the tissues, what is limiting you in your movement, that we call tension. We also have the skeleton and then the shape of the skeleton. So there's more to say about the whole skeleton and all the joints and all the movements. But in this webinar, I wanted to focus on the hips. As in yoga, we talk about hip openers a lot. And what are hip openers actually? So hip openers in yoga are actually any position that you do to open up the hips. So whether your legs go far apart to open up the inner thighs, or that one leg goes back to open up the front of your groin area or the hip flexor area, or whether you do a cross-legged position or shoelace position, for example, as we call it in Yin Yoga, and you go forward, then you stimulate all the tissues on the back. So basically, I'm going to stand up and show you on the skeleton. So basically, all the movements that you can do with your legs, whether it's flexion, the leg going forward, that's called flexion, whether it's called when you do abduction with the leg, whether it's extension, the leg going backwards with the leg, whether it's external rotation, so the leg and then the foot turns out, or inwards, that all has an effect on all the tissues in this area around the hips. So on the front, on the back, so the bum area. So there's a lot of muscles here, but also there's a lot of fascia. So when you do a lot of yin poses, for example, they focus on this area. So to open up all the fascia that is very dense and compact in that area. So that actually the goal of that is to keep the SI joint, which is this part where the ilium bone, those are the ears of the pelvis, so you could say, and the sacrum come together on both sides. So that is your SI joint. And we need that movement to be able to walk comfortably and to be able to move comfortably when we run or when we sit or do any movement actually with the legs. So in doing yin poses that target these areas of the hip, actually you stimulate the fascia to stay lubricant, to not dry up and become very tense, because that eventually can give you this feeling of like not being able to move, or in the worst case scenario that the sacrum and the ilium bone fuses together due to the fact that you're not using that joint in the body. So that's a little bit of an intro of what is a hip opener. But in this webinar, I'm going to focus on the external and internal rotation possibility of the hip and how that looks like. So I wanted to grab myself and the skeleton. So I'm just going to put him a little bit more forward. And I'm going to talk about, first of all, about the hip socket. So the hip socket is where your leg is entering or connecting to the pelvis. So this hole here that you can see is where normally, Hugo has a little bit of problems with that, but normally the head of the femur, that's this ball, it's called the head of the femur, is entering into. So just to kind of show you what the hip socket is, I'm going to take off his leg. So that is this part, the hip socket is this part in the pelvis. So it's also called acetabulum, the anatomical name for it, but hip socket is also known, easily known and used. So here, the rim of the hip socket influences how you are able to move your leg. Also, the position or the orientation, so to say, of the hip socket determines how you can move your leg. So this is one example of how the hip socket is orientated. So if you look at this hip socket, it's actually pointing straight at you. But if I would put him really put his hip from the side, then actually you can see that it's pointing a little bit forward and down. So it's kind of tilting forward and down. So kind of in this direction, like my hand is. And it's not completely over onto the lateral side and not completely to the front. So in this skeleton, this hip socket form influences the way you can move your leg. But we're all different. The bones, we all have a pelvis, but the hip socket is shaped in different ways for everyone. Sometimes it is pointing more forward, sometimes it's pointing more down, and then the rim of the acetabulum is, for example, more protruding on this part, or the back part of the rim of the acetabulum is protruding more. So you can imagine if that would be the case. So I'm just going to take this off so that the head of the femur fits in nicely with the pelvis. So in this pelvis here, if I want to, for example, flex my leg forward, then at some point in this hip socket, the rim of my hip socket is compressing with the neck of the femur here. If I'm going to internally and externally rotate, that's what I'm going to talk about. Then here, I'm externally rotating when he's standing up, right? So here, if you could zoom in on this part, then again, the rim of the acetabulum is compressing with the neck of the femur. If I do internal rotation, so that means the foot turns in, then here on the front, I get compression with the acetabulum. So, and this acetabulum, the rim of the acetabulum is not neatly shaped. It has a more protruding part or goes inwards. So depending on this shape and the orientation determines how you can move your leg. So now I've done it with standing, but in most yoga poses, and especially Yin Yoga poses, where internal or external rotation of the femur is involved, we're sitting. So you are doing flexion in that moment. So if Hugo would be sitting on the floor right now with his bum, right? Here is the floor, and he would externally rotate his leg. So I'm just going to externally rotate. Well, he has actually a lot of range of movement here because in his hip socket, there is this little dent where he can go a lot there. If the rim would be protruding here and it would hit here, then how the body shows us this, because of course you at home, you cannot tell how your acetabulum looks like or the rim or how it's orientated. But you can notice what the end of the movement is. And that is when the other side of the pelvis, for example, is lifted up. Because if there's no more movement here and you don't feel any stretch or tension on the muscles that or the tissues that are here on this side, which means stretch, you could feel, then, and if the pelvis is lifted, that means that because of this movement cannot go further, the body reacts or tries to compensate by lifting this up. So as I don't have somebody here to show it to you on, so I'm going to try and show it to you on my own body. So I'm going to grab a chair, but when you try this at home, it would be great to have somebody there. So you're going to sit in front of the chair. You're not going to sit way back. You're not going to lean back, but you're going to sit in front like this. And then that person is going to grab your ankle and your knee and it's going to turn. So I'm here with the knees together. So that's an adduction. I'm sitting, so my femur is also in flexion. And now if I externally rotate without abducting, this is my range of movement. If I push myself further, it's kind of difficult because I have to lift my own leg. This is the end of the movement. I feel that now I'm starting to actually lift my own pelvis up by trying to push my leg further in external rotation. So if you have somebody at home to do it with you, have them place the hand on the knee and one hand on the ankle, and then turn the leg out. Yeah, don't pull on the foot because then you're going to hurt your ankle. And you're just you don't have to push hard, but just kind of see the range of movement there. So I have a lot of external rotation, but I have more, I know, with abduction. So I'm taking my leg out to the side. And now I'm doing it again. And then this is my external rotation possibility. If I push myself more, then this hip lifts up. For the internal rotation, the same test can be done to check what your internal rotation is. So here, I know this, my internal rotation is this when I have my legs in adduction. If I abduct a bit, then I have a little bit more, but actually my leg wants to go down. So actually my body is already telling me it wants to go for the path of the least resistance, because if it stays up here, it knows, okay, no go there. If I relax my leg and it goes down, then I have a little bit more internal rotation. You can be either in the group of more external rotation than internal rotation, or you can be in the group of more internal rotation than external rotation, or some people have equal amount or a lot of range of movement of both rotation possibilities. So, and that is not determined by tension. If you have done a lot of yoga and you have worked on your tensions in your hips, so either on the front or on the side or in the bum, then at some point you're going to hit compression. We do not have an unlimited range of movements. The end of the movement is going to be compression of bone. And of course, we don't have just the bones here. It is all surrounded by tissue. So it's not literally just compressing bone to bone. There's a cartilage here in between. There is ligaments in between. So that would be compressed a bit. Yeah. But okay, the compression can just go so far. Eventually it is compression that is going to stop the range of movement you have. If you have worked on your tension of the muscle tissue and the fascia enough. So how does this look like when you do a pose? So I wrote down butterfly to start with. So if you would sit down at home and you put yourself in butterfly, and it doesn't matter where the feet are, you can place them more to the front or you can place them closer to the pelvis. I'm saying this because it again depends on where your hip sockets are orientated towards. In my body, I know they're pointing outwards more. So if I put my feet more forward, actually my legs want to go, or my knees want to go up. If I put them closer in, so now I have more abduction with external rotation and flexion of the femur. So now my knees can go all the way down. I don't have to push, just my body just like, oh, okay, here I can relax more. If I go forward, then actually I don't need to do anything. They just come up. Because with less abduction, I have less external rotation possibility. So when students ask me, like, where should my feet be in butterfly, I always say, choose the position in which you feel that your knees can go down most relaxed way, which means that the possibility of your most external rotation in anatomy way of saying it. So it doesn't matter if your legs are here or here, because the function of butterfly eventually is, when you go forward, to stimulate or to stretch or to feel it in your glutes or your butt area. And also because you're rounding your back, you might also feel this in the back. Where you're rounding, you feel a stretch, perhaps, maybe even in the neck. And then you're just staying here for 5, 7, 10 minutes, as long as you wish, until you feel that the stimulation is still going on. Yeah. So some people feel it a lot here in the inner thighs. Well, that's good. That's still a hip opener, so that is okay to feel, that you feel it there. So maybe less abduction, so bringing the legs more forward, gives less of a stimulation here and more maybe of a stimulation in the buttock area. So it all depends what you want the pose to do for you, where you want to target your body, how you want to stimulate it. So instead of adapting your body to the pose and trying to do the pose and look like somebody in a yoga magazine, or do you actually experience the pose and feel what the pose is for? And that is actually functional practicing of yoga. Instead of looking or trying to achieve a pose from a picture, you achieve to feel and what the pose can do for you, if it's doing something for you. And then some people actually need more abduction of the legs with external rotation and flexion, because I'm still sitting. I'm still rotating externally out my legs. They need more abduction to feel either something in the back of their bum or in the inner thighs. So that is also doable. Some people, they don't feel this, and they need to kind of cross their legs. Now I'm having compression with the floor, so I move back a bit with my ankle. And then crossing the legs slightly and then going forward. And then they might feel it in the bum area. And then also you can play with the torso to kind of increase or to feel it differently in the area that we want to stimulate, and that is your bum area. If you notice that the pelvis falls backwards, then also play first with the feet. So sometimes this happens. People put their feet there and their pelvis falls backwards like this. And then they want to go forward. Well, you can imagine this is not really relaxing. I'm pulling myself forward. I'm actually pulling myself into compression, because my body, if I would have this, actually this position of my legs pushes my pelvis backward, and therefore I'm not able to fall forward. So then sometimes people place a blanket underneath, could help, but then you diminish the flexion of the leg, but you're not doing anything with the abduction or external rotation. So that could help to fall forward, but maybe not. Maybe that is not the problem. Maybe the abduction is the problem. So then placing your feet forward maybe helps to allow the pelvis to fall forward also. Yeah. And whether the knees are higher up or lower down, that is not important, because it all depends on the external rotation you have that your skeleton is able to give you. Yeah. So that is external rotation. And then we have saddle. Saddle is another pose students ask me a lot about. So saddle, it is said or taught by a lot of people that we need to sit in between the feet and then go backwards. Well, you're kind of seeing in my body that my body doesn't like this at all. I feel this right away in my knees and right away in my hips. And I've shown you before on the chair that I do not have a lot of internal rotation possibility. So for me to just sit in between my feet like this, right away goes into my joints. And why is this? Because my body cannot make that internal rotation. So what the body does, okay, you want me to do this, but then I'm going to show you that this is not really the way to go by expressing the uncomfortableness in the knees or in the hips even. So for me, this is not an option. If you have a lot of internal rotation possibility of your femur, then for sure you can sit in between the feet. So I do that test also with people in classes. I say, okay, try to sit in between your feet. And if this is not a problem for you at all, or you don't feel this in the knee, or don't feel awkward in the hip, then for sure you can sit in between the heels. But if you feel awkward or you cannot even go down with the hip, which is another example of your own femurs are keeping your pelvis off the floor because there's compression in the hip socket. Your skeleton cannot make that movement. So it's not allowing your pelvis to go down. It's not tension if you don't feel it in the tissues. I don't feel this in my tissues, I just feel it in my joints. So that's a way of your body telling you, that's not the way for my body to do the pose. So in my case, in my body, I sit on my heels and then I go backwards. Yeah. And whether my knees lift off the floor or my legs want to separate, I allow that to happen because the function again of this pose is to feel it in my quads, my hip flexors, maybe even in my belly if I go backwards and I make a back bend and an opening in the chest. But then I want to feel a doable pressure in the lower back. So nothing sharp and stinging and uncomfortable that you cannot hold for 5 minutes, that you're able to do this for a long period of time. So if the pressure is too much, that again has to do with the legs. So if your legs are like this, you're doing saddle with 2 legs at the same time, your pelvis is not able to move. So if saddle with 2 legs, whether you're in between the feet or on the feet, that doesn't matter, but you feel a lot of compression, then actually half saddle can really help you out and give the benefit. So maybe you can zoom in onto my hips first. So if I go back, you see that my hip tilts backwards, so it's flat. In some bodies, it stays up here. So that means that in the hip socket there, something is happening that is not allowing the pelvis to go further down. So then what the body does is to take it from the lower back. So the back bend will intensify, and maybe the pressure there as well, up until where it's sharp and stinging. So it's not going to go anywhere. So if that is the case, and you don't feel it here, then if you release one foot, so now I'm releasing one foot, doing half saddle, I have the other leg still bent, and then you can see my pelvis tilts away a little bit towards that area. And then maybe it might be doable for your body to stimulate your quads and hip flexors here. And now I'm internally rotating. This I can do in my body. With one leg, I can internally rotate because I'm able to turn away with my pelvis a bit. And actually my left hip it's not completely on the floor, but that's okay. It gives me a good stretch here. I don't feel it now in my hip knee joint or in my hip. I feel it in the area that we want to stimulate. So that's fine. I can do whatever I want with this leg to either increase the stimulation or to make it different in a different area of my quad, or it becomes less in certain movements. So you can do whatever you want with that other leg or with the torso even. You can move to the side, and then actually I feel it all the way up in the torso. It doesn't matter what you do with the rest of the body, as long as you do not feel this in the joint. You want to feel it in the area, what the pose is supposed to stimulate. And then how it looks like, it doesn't matter. Because our skeleton is different and unique for every one of us. Nobody is the same. So if you try to do a pose, feel first. Where do I feel it? Do I feel it in my joints? Is it sharp and stinging? Okay, let that be a sign to adapt the pose. And then search for a way, and there are endless variations actually, to do a certain pose, to be able to feel the function. And then the last pose I wanted to discuss, and then we can do some questions, is deer. So there you have external rotation and internal rotation of the other leg. So as you can see again, I like to abduct a lot, take my legs out to the side, because if I close them, I have less external rotation here. My hip lifts up more because I'm actually kind of pushing with my femur in my socket, my hip up. So here, if I abduct more, for my body, this is the best. Still, my left hip is off the floor, and then students ask me, oh yeah, but should not the hips be on the floor? No, because I can't. If I would push myself down, I actually feel it here on the top because there's compression in my hip socket there. It depends again, what is the function of the pose? So in deer, you can go forward, and then it can be for your glute area that you can feel it there. And again, you can play with the torso in any direction to feel it there. Or for some, going forward, they feel it in the adductors, so the inner thighs. But you can also do deer going backwards. And actually, that's what I just did with half saddle. Yeah, so going backwards. So then you stimulate this area. You can also make a twist of it. You know, you can go and turn that way. And then maybe it feels in this area more. So you can do in deer whatever you want, but again, the position of the legs and where they are is not important. It depends what you feel when you go into the pose. What is it what you want to stimulate? What do you want to use the pose for? And then not feeling it in the joints, in the sense of sharp stinging sensation, or that you're like, I actually want to put my leg here because it starts to hurt in my knee. You know, we don't want to, when we do a hip opener, we don't want it to become a knee opener. There are no knee opener poses in yoga. We don't want to open up the knee. That's not the whole, that's not what we want. We want to open up the hip. So you should be able to feel it then also in the hip area. So that means the tissues that are there, the muscles, the fascia, and not in the joint within, deep inside. So I think that's the most important things that I wanted to say. Maybe you have some questions and I can elaborate a little bit more about things. And if you're not here and you're watching this later, you can always still write a comment and then I will answer it later via YouTube also. And I don't see any questions. So maybe, no? Delay? Oh, there's a delay. Okay, I wait. Okay. Hello, Claudia. Good to have you here. Why you're not able to do shoelace? Well, I don't know. I need a little bit more information because it can be that you do not have a lot of external rotation when you do shoelace, because shoelace, as you can see, I'm sitting. So first of all, your femur is in flexion, your leg is in flexion. You adduct because the legs are together and you're externally rotating. So if you do the test, for example, on the chair, and you look at your external rotation with adduction, so keeping the legs close together, or then take one leg out more to the side, so you're abducting, and then external rotation, maybe that's where you have more possibility to do so. So if you can be a little bit more precise on what the trouble is in shoelace, do you feel it in the knee? Do you feel it in the hip? Does the knee stay up very high? Okay. Okay, I think Claudia, I need some more time. There's some delay, so probably Claudia will give me some more information later on. Then Christiana, welcome. She's asking, how do you realize if it goes to the hip joint? Okay, because in the knee you feel it right away. Yeah, that's a good question. But the hip is so densely packed with muscles, you don't feel a sharp stinging sensation in the hip area happening, like what I just did with the chair. You don't actually feel that there is compression in the hip. There are no sensors there that give you that sensation right away, like in the knee. And also, the knee is a very different joint than the hip joint. The hip joint is a ball and socket joint. It can move in 6 directions. The knee joint is a saddle joint. It's very different. So you can only rotate when the knee is bent, and you can flex and extend the knee. It's a very different joint. So a good cue to remember is when there's something occurring in the hip, that's what I said, then the body will lift the pelvis up or push it back or not allow it to go forward. So what I said with my internal rotation, my hip here doesn't go to the floor because I don't have the internal rotation forward to do so. If I bring my legs forward and I want to go further forward here, this is it. I'm not able to go further forward, but it's not painful. Yeah, if somebody would push me, yes. But if I put my legs like this, then I can move forward from the pelvis. So there is no compression happening now here. So any moment when, for example, in shoelace, you cannot bring that hip onto the floor, it's because in there, in this position of the legs, you do not have enough external rotation, so it lifts it up. So that's an indicator of letting you know there's compression happening in the hip. In deer, Christiana, I feel it in the knee the most, and I think my internal rotation is limited. Yeah, I think so too, Claudia. If you feel it in the knee, it has to do also with the rotation of the tibia, because you have 2 bones here. One femur connecting with the hip, that's one joint. And then here, this is the tibia bone connecting with the knee. And that's the knee joint, or that connecting with the femur here, so that's the knee joint. So what the body does is, in shoelace, if you don't have enough external rotation, and here is the floor, your foot is resting on the floor or your shin is resting on your leg, that can create pressure onto that part of the body, and then make this movement. And that is abduction, and that's something that the knee cannot do. So you would feel that on the outside of the knee, too much pull, or compression on the inside of the knee, like a sharp sensation. Yeah, so this is a movement that the knee cannot make. The knee can do flexion and extension, and it can, in flexion, do rotation, but not abduction like this. Imagine here are all the ligaments. So if your femur does not go any further with external rotation, your knee would try to compensate for it. And that's not what we want. So that's what I think is happening. So you could go for shoelace. Instead of shoelace, you could go to square pose, which is with abduction, and then fall forward. And then you hopefully feel it in the bum area and not anymore in the knee, because that's what the function of shoelace is. Anna-Sophie, hello. My left knee is up. I feel pain in my right knee. Okay, so Anna-Sophie, You can do with shoelace with the right knee up, but when the left knee is up, so you mean on top, I feel pain in my right knee. So when the left leg is up, that's how I understand your question, your right leg is down. So this is actually the same thing that I just explained, because both of the legs are making external rotation and you are abducting and flexing. So the lower leg needs external rotation and the foot is going to go this way. So some people say, oh yeah, my foot needs to be here. Well, you can see how my body reacts. This doesn't like it. My hip is lifted up. If I press down, now I create again abduction in the knee. And I feel that there and there. Actually, my knee doesn't want to go down. I can push, but that even feels worse. So again, the foot is not important. You can bring it closer in, and then my body gives me the possibility to do so, because now I'm internally rotating also from my tibia. So if this is too much information, because you need to go through all the joints to be able to understand this well. So that is in the online Yin Anatomy 50-hour TT, and we go through all the joints of the body. But now I'm just telling you quickly what happens. So that can also create pressure here. So it can help to sit up onto a blanket. So as if you are digging a hole for your foot in the floor to go a little bit down, so that you're not creating the abduction in the knee. So that might help. Try that. Yeah, so lack of internal rotation of the femur, I guess, affects lotus. I have a lot of external rotation of the femur. So, okay, so Ellen O'Connor, thanks for your question, but I think you are referring to the internal rotation of the femur. Well, in lotus, in my opinion, you need to externally rotate, right? Because lotus is this. And I have a lot of external rotation, but then to put this foot on there, again, has to do also with your possibilities in the knee joint and of the ankle joint. So it is not only the external rotation of the femur that you need to do lotus pose, you also need internal rotation of your tibia, and you might need some inversion of the ankle joint. So there are more joints there that are involved in the lotus pose. So for my body, if I let it go, then my body wants to go this way. You know, I can try and sit, but you can see that this knee doesn't want to go down. Because now actually to be able to have my feet on my legs, I need to adduct more. And my body has more external rotation when I abduct. So if I do this, you can see my knee relaxes on the floor. So lotus pose should not be an aim to be able to meditate for hours. And lotus is mostly done when you're meditating. I don't know if you are meditating in this pose, but when you meditate, you want to take a position that is suitable for your body so that you're not distracted by the physical sensations due to the pose you're in. So maybe pick a different meditation pose. There are different poses that you can choose. You can cross the ankles, you can put the foot in front, you can either sit in seiza, you can use a bench. That's not better or worse. It's just choosing the right pose for you to meditate in so that you can stay still and observe your mind and everything else that is happening inside. Oh, great. Great, Anna, that it worked. Super. Okay. So if there are any questions left, please let me know. And otherwise, you can always leave it below the video if you're watching this later on. Okay. Yeah, I don't know, Ellen. It can be in the 3 joints. So it can be the femur, external rotation. It can be the tibia, internal rotation. And it can be the ankle. So, um, and also due to the position that your legs are in, maybe it pushes the pelvis back. That's something to look at as well. Yeah. And then Francis. Hello, Francis. I don't feel to seem to feel the stretch. No, I mean, yes, it's normal. Um, Most of the people that begin with yoga, whether it's yin or yang, they feel a lot of tension because they're not used to put their body in all these different poses to stimulate their body to either make it stronger or more flexible. But when you have practiced a lot and you are stimulating your body in a lot of different ways, then at some point you're open. So there is less tissue resistance, so to say. So then maybe you can adapt the focus more and make it more deeper, as a yin practice is very suitable as a meditative practice or as a mindfulness practice. And just to turn in and just to be able to sit still. And there is always something happening inside. Maybe observe the state of your emotions, of the state of your mind, or certain patterns that you have, thinking patterns that come up just while you're still for 5 minutes. So just the focus becomes different. That having said, you can also maybe try to play a little bit more with the body. So even though you're doing the poses of yin in a certain way, see if you can play a little bit more, maybe with the torso or the position of the legs, and maybe all of a sudden a new sensation arises in that area that you want to target. So 2 things, it becomes more of a subtle practice than instead of a physical practice. Okay. You're welcome, Christiana. So that's actually a good thing that Francis asked is yin practice is not only about getting more open and flexible. It is actually a very meditative practice where you can become aware of everything that is happening inside, to actually to learn to become still and to be able to observe, which is a great thing to learn and to use in your day-to-day life. So instead of always reacting right away to something that is happening or getting triggered, you have the practice of yin that helps you to kind of take a step back, observe, feel, and then from there choose how you want to react. So that is, in my opinion, the greatest thing that yin yoga practice can bring you. Would you be able to advise some exercises for fascia and lock of hips when they are very stiff, please? Hello, Blueberry. Yeah, well, that was actually what I was saying. Like in Yin Yoga, we have all these different poses that open up and stimulate the hips in different ways. So now I just talked about making the movement of the leg rotating inwards and outwards. But you can also abduct and then fold forward. So that would be the dragonfly, or do dragon pose where you have one leg in front and the other one going backwards. So in other webinars that are coming up, I will go more in depth in those movements and how that affects the pelvis and your ability to move, and give some examples of poses. But actually all those yin poses that are for the lower body, so placing the legs in any kind of position, so either cross-legged or forward or out to the side or twisting with the legs, all that opens up the hips in different ways. So I hope that helps. And it also depends on where the stiffness is in your hips. You know, is it in the bum? Is it in the front of the hips? Is it in the inside of the hips? So that all depends where you feel it, what poses you should do. So if you have a lot of tension, for example, here, then any pose that opens up that area would be great. If you have a lot of tension in the bum, all these poses that we did today, saddle, deer, butterfly, shoelace, square, can be done to open up the bum area, or sleeping swan, or eye through the needle, or eye of the needle. Yeah, and if you have, oh, I didn't read that before, sorry, but sciatica, no, that's no problem, Blueberry. It's okay. So you can rewatch the video to listen to my talk, but with the sciatica, you have to again feel, because sometimes the nerve can get compressed between the muscles in your bum area. So then again, it depends what you feel when you do a pose. So some people feel really the nerve shooting when they fold forward with their legs straight. Yeah. Others feel it when they have their legs externally rotated and with abduction. And others feel it more when they externally rotate and with more adduction, but still not completely. So if you feel the shooting of the nerve in the pose that you're doing, then that is a sign that you should play with that position so that you really feel it in the tissue, in the bum area, the muscles of the bum, and not have this shooting sensation, tingling sensation. That is not what you want to feel. So then you should adapt the pose to what your possibilities are. So actually, that is always the thing. The first question is, what do I feel? Do I feel tension in a certain area? That's great. That's what the pose is for, and that's what you want to stimulate or open up or release, you know? If you feel it in the joints, that can be compression, yeah? Or when the hip is lifted up, that can be compression, and therefore you don't feel the stimulation in certain areas. So that means that you need to play a little bit with the pose, or do a variation of the pose, or sometimes you need to do a different pose that targets the same area. So think of shoelace. This pose is shoelace, but square is also targeting the bum. So depending on what the shape of the bones is giving you, you can choose the pose that targets the area for you the best, for your body. Great, thank you. Super. So if there are any more questions, please let me know. Rebecca, when I do saddle back bend. Okay. Localized twinge to the left of my navel and in my left hip area. Okay. Yeah, this is very specific, Rebecca. So I really need to see what you're doing when you're doing saddle. Do you do it with two legs at the same time? Is it coming from the back that you feel this twinge in the navel, or where in the left hip area do you feel it? I needed a little bit more information to be able to answer what can be happening there. So Yes. Okay. Yes, meaning on the compression due to the back, on the back, or the back of the hip. Okay, so you mean the back of the hip that you feel it in this area here? Or does that mean that you feel this in this area here in the SI joint? That is something that I need to know. Well, when Rebecca can give me an answer. So, what I mentioned before, in the 50-hour Yin and Anatomy online training, we go through the whole body and we analyze the poses that are targeting these areas and also how you can adapt them and how you can understand what is happening in your body. So if you have an interest in that, it can be very useful also for your young practice and for any kind of sport where you need to move the body. And then in the 30-hour, yeah, Yin and Meridian one, then we target more the emotional aspect and the energetic aspect of the practice. So then we dive deeper into the mind and into the meridians and what is chi and how can we stimulate that with the various poses. So now Rebecca says, okay, the SI joint. Okay, so if you do the saddle with 2 legs, I don't know if that is the case, Rebecca, but then you can try to do it with 1 leg at a time. Because as I explained before, when I did the saddle, 2 legs at the same time, the pelvis cannot move because the 2 legs are keeping the pelvis in that position. So when you do it with 1 leg, then the pelvis can maybe incline a bit or turn away a little bit from that leg that is still bent, and then also release, therefore, in the SI joint area. So you could try that. You're welcome, Angie. Okay. Rebecca. Oh, okay. Yeah, so Rebecca, that can be a good help, I think. If you watch the beginning of this webinar, you might be able to get some variations for the saddle that might be helpful for you. Yeah. Okay. So remember, if you have any more questions, you can leave it below the video if you're watching the recording. And other than that, thank you for being with us and being patient for the sound issue and reconnecting with us again. Thank you very much. Namaste.